Hip fracture. Information for patients, families and friends. Did you know that in Australia and New Zealand, there are national recommendations for the care that should be provided to an older person with a suspected broken hip? These recommendations are called quality statements, and they can be found in the Hip Fracture Care Clinical Care Standard. To help you understand a little more about how these recommendations are used, we would like to introduce you to Margaret. She lives at home with her husband John, and she is usually very active, walking for exercise each day and volunteering at her local library. Unfortunately, Margaret tripped on a carpet at home and hurt her hip. She was unable to get up, so John called an ambulance to take her to the hospital. When Margaret first arrived in the emergency department, she was asked about her pain. This is an important question because relieving pain early is very important. Margaret was asked about her pain in the first 30 minutes of arriving at hospital and was given pain relief if it was needed. The pain relief is usually given as a nerve block, which numbs the leg. Managing Margaret's pain early allows her to move for any x-rays and nursing care, and asking Margaret about her pain for the whole time she is in hospital is one of the national recommendations in the Hip Fracture Care Clinical Care Standard. The x-ray shows that Margaret has broken her hip, so the hospital admits her to hospital and plans are made for her treatment. Margaret is looked after by a multidisciplinary team of doctors, nurses and allied health professionals. To help with planning the right treatment, Margaret and John are asked lots of questions. These questions check Margaret's memory and thinking and helps the team to understand her goals of treatment based on what is important to Margaret. This helps with the creation of an individual care plan. The Hip Fracture Care Clinical Care Standard recommends these questions should be asked so that the team can plan Margaret's treatment and recovery, knowing what is important to her. The multidisciplinary team advised Margaret the best treatment for her is an operation. After considering the doctor's recommendations and discussing them with John, Margaret agrees to have an operation to fix her broken hip. The Hip Fracture Care Clinical Care Standard recommends the operation should be done within 48 hours of Margaret arriving at hospital. Everything moves very quickly, and the day after the operation, the team give Margaret an opportunity to stand up and take some steps. Research has shown that people who are able to stand and step the day after surgery have better mobility and more independence even after 12 months. This is why getting up from bed the day after surgery is recommended. Getting up can be scary and very hard, but the health professionals and family and friends support Margaret so she feels she is not doing this all on her own. Each day, Margaret walks a little bit further and gains a little bit more confidence. However, she is worried about how she will cope at home. Margaret and John talk to the different health professionals until they are happy that the plan for Margaret's ongoing recovery is just right for her and will give her the best chance of getting back to the things she enjoys. This plan includes checking her bone health and a plan to reduce the risk of another fall. It includes exercises to improve Margaret's strength and balance, a plan to remove hazards in her home, and talking to a doctor about medicine to strengthen her bones. All these appointments and plans are written down, and a copy is given to Margaret and John and also sent to her family doctor. Margaret is now ready to start the next part of her recovery.